Hi, this is Betty Long, founder and CEO of Guardian Nurses Healthcare Advocates. Welcome to Season 7 of the Lighting Your Way podcast, a season in which I continue to talk with my Guardian Nurses colleagues and hear from them about their day-to-day support of our patients and clients. Their stories are heart-wrenching, uplifting, empowering, frightening, captivating, and true. Welcome to Season 7. At Guardian Nurses, we often will refer to cases as four-alarm fires, meaning they require our immediate action. In this episode, I talk with Alonda Wood, the mobile care coordinator nurse for the Philadelphia Firefighters and Paramedics Health and Welfare Fund. Alonda supports the men and women who fight the actual four-alarm fires, and we are all grateful for their work and proud to help them when they need us. Alonda Wood, welcome to the Lighting Your Way podcast. It is good to finally have you as a guest.
Good afternoon, Betty. Nice to be here. Thank you.
Sure. It's been a couple years, and finally I scored. I must have talked to your agent the right way and got you to be a guest on the podcast. Alonda, you have been on our team as the mobile care coordinator for the Philadelphia Firefighters, which is a huge fund. How many members do you have all told?
I have, as we say, 8,800 belly buttons.
That's a lot of belly buttons.
It is.
Wow. So 8,800. And do they all live in the confines of the city of Philadelphia, or are they outside in the suburbs as well?
Honestly, they live a little bit of everywhere. I've spoken to members as far as Florida, Arizona, once they retire, of course. I even have had a couple of current members who list their address as New York. But they're here now. But primarily in the city, with the scattering and all the, outlying counties.
Okay. And your responsibility, and I know we've had our colleagues on at previous episodes this season, and as well as other seasons, but your primary responsibility, because you can only do so much with one nurse and 8,800 belly buttons, is to, I'm going to use it, I'm going to say it, put out fires. I had to. It was easy. Stare me in the face. So you're the acute nurse, and that means you are what? Tell us about your day-to-day.
Primarily what I do day-to-day I visit members when they're admitted to the hospital, accompaniments when they go to different physicians, and like you said, put out fires. I will say that most of my members will work on something, and then I'll get that call when they've exhausted everything that they've tried. So literally put out fires, and a lot of second opinions, which is good.
Yeah, and I think that the firefighters, doesn't it also include the paramedics, because they're in that union as well, correct?
Oh, definitely. Firefighters, paramedics, EMTs, and their family members who are on the insurance plan.
Okay. So probably as many of us who are in healthcare believe that we can do it on our own.
Yes,
when we
exactly.
have an issue.
I just got off the phone with a member a couple minutes ago, as a matter of fact, and he was doing everything correctly. He just wanted to make sure, and he says, "You guys are the experts. Just please make sure I'm doing the right thing." And he was. And by the time we got off the phone, we have planned on 2 accompaniments. So that's a nice, it was a nice call.
It doesn't matter. I mean, I've certainly had that experience. I'm sure you have. Even though we're nurses, when you go into a doctor's visit by yourself, it can be overwhelming. I mean, I've had the good fortune of having some of you accompany me to appointments, and it gives you peace of mind that somebody else is listening. So I can't imagine he would not feel that as well.
Yeah, well, he was shocked that, you do that? I said, absolutely.
Right.
And he was shocked. He's like, "Oh wow!" He's like, "What a service!" He's, now already feels like he's going to get more out of the visit, and they do. You sit there and an appointment. Like if I went to a cardiology appointment the other day with a firefighter. It was an hour long to discuss high blood pressure.
That is only because you were there.
And we walked out. We walked out of the building, and he looks at me, and I was like, "Look, you got that appointment because I was sitting there. An appointment that long because I was sitting there." He's like,
Right.
"Yeah, I kind of thought something was
Right.
up."
Right. The doctor was showing off as usual,
It was
right?
great.
The doctor was showing off.
I mean, she's looking up blood pressure monitors. She's looking up videos on the American Heart Association. It was impressive.
Wouldn't it be nice if we all could get hour-long appointments with our doctors and not have to pay concierge prices?
Absolutely,
Yeah.
absolutely.
So, Alonda, you came to the Guardian Nurses team after, most recently from home care. So, how long were you working in home care?
I was in home care for 30 years, believe it or not.
Wow. Wow.
Yeah.
Wow. Just a
Yep.
few years, huh? Wow.
Yep. 30
So,
years.
when you think about all that you did, because home care nurses are pretty creative, because you have to be. When you think about your role there and now being on the GN team, are there similarities? Are they differences? Talk about what you think, coming to Guardian Nurses has meant in your career.
Well, definitely working in home care as long as I did. Definitely like the discharge process. And because when I go to these hospital visits, knowing both sides, I certainly, can say, hey, this is covered. The rehab is covered, or you pick a walker or a cane or a wheelchair versus I know those little nuances because believe it or not, most people kind of think their insurance covers everything, including a 24-hour aide or a 24-hour nurse, and it doesn't. So oftentimes I'm the bearer of bad news saying, no, this is what your insurance is going to cover. But I have good insurance. You do, but this is what it's going to cover.
Yeah.
So that's been exceptionally helpful. And even the difference between, if they need hospice versus home care versus palliative care.
Okay.
And that can be a lot of good information for patients being discharged. And like you said, the creativeness. I mean, in home care, you just always had to figure out a way to get it done. I mean, oftentimes folks didn't have the money that they needed. So you were constantly researching ways to get this drug or that drug or whatever the case may be. I mean, I would find, I'm blanking on a name that I need. A thrift store. What's the thrift stores that are so popular where people drop off things? But there's one
the Goodwill?
Goodwill. There is a Goodwill thrift store in New Jersey for DME. Somehow I found that along the way in life. All those little things can be a really big deal to folks who are, don't have the finances.
Oh, absolutely. And I think when I was a case manager in the hospital, my manager, kind of the first couple of months when I was trying to keep people in or get them to a different facility, and she was like, Betty, if their insurance doesn't cover it, no matter of fighting is going to matter. And I was like, okay,
And
so
that's
you
the
got
truth, and that's what I've said to people like my whole health career, when folks go, well, I want this done, but my insurance doesn't. Sometimes there's a reason they don't cover things either, if you know what I mean. Like they're not effective. That's why it's not being covered, or this rehab doesn't do a good job. That's why they don't cover that rehab. I mean, sometimes there's a reason. Not that I always want to defend an insurance, but sometimes there is a reason.
Yeah, I
Uh,
mean, you'd like to think that there's a method to their madness, and it's not just insanity.
right.
So you came to us from home care, and now you're working with the firefighters. Is there any recent case that kind of stuck with you that you'd like to share with our listeners?
Yeah, sure, sure. This one lady that I had sticks out to me because I'm still in shock. But she was,
Oh, it sounds like a good one. Okay.
yeah. She was actually a retired firefighter's wife who had ended up in the hospital. She was diagnosed with a pretty severe kidney tract infection. Um, she was started on a particular antibiotic and initially was doing well. And then I connected with her. I think she had been in for 2 days, and as I said, was doing well. I talked to her the third day. The fourth day, I went back to see her again, and by then she was complaining of severe dizziness, nausea, and just really severe headaches. And she's like, yeah, she says, these symptoms started a couple of days ago, but they were mild. But she said over a 2-day period, they just kept increasing and increasing and increasing. So I kept asking her questions, and began to research this antibiotic she was on, which was new to her. She had never taken it. And I really was wholeheartedly convinced she was reacting to the antibiotic. Of course, I was at the hospital. I asked to speak to her doctor, who was actually off. And the nurse said, well, it doesn't matter. I don't think he would change the medication anyway. And that kind of left me and my member a little speechless.
Well, wait, back up,
Asked,
back up. Did
yeah,
so this patient is having symptoms. Has she
yes.
reported it to the nurse?
She had reported it to the nurse who supposedly um, called the doctor. But when she said that the primary doctor was off, I thought, well, who did you report it to? Because she told me the doctor was off. So
Yeah.
I don't know if the doctor was really off or not, because A, she's telling me she reported it to the doctor, but B is telling me the doctor was off. And that the covering physician, she felt would not make any changes because obviously he was just covering for that day.
Okay.
So I asked, I said, oh, well, is infectious disease involved? And she, oh, I don't know. She said, let me go check. And she did come back and she told me that infectious disease wasn't consulted as of yet because they felt the patient was getting better. So we waited. She spoke with her doctor the next morning. But by
And did he?
now,
This is the original doctor that ordered the antibiotic.
yes.
Okay.
But by now, her liver function tests were off, and he was going to order a liver ultrasound. Her
Oh.
blood work also showed low platelets. And I'm sitting there. I was on the phone with her because I called that morning. And I said, well, do you have a history of any of this? And she said, no, 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 no. She said she was insistent about stopping the antibiotic, but the doctor wouldn't stop it. And I proceeded to keep researching the antibiotic. I actually called a pharmacist that I have a lot of regard for and a lot of respect for, and he confirmed everything that I was finding, which was the thrombocytopenia, which was low platelets,
Wow.
the hepatic toxicity, which was the increase in the liver function test, and the neurotoxicity, which was the dizziness and headaches.
So she's having these symptoms, and no one is paying attention except you.
Mm-hmm. Her husband was he was ready to explode. And I was like, look, let's just do this the right way. Met again she met again with the physician. And at that point, she asked him, can I call my nurse? And he refused for me to participate in the conversation.
Oh,
So,
jeez.
yeah. So at that point, I mean,
Hmm.
I said to her, I said, the only way we're going to get this antibiotic stopped is for you to just simply refuse it. I said, the next dose, when the nurse comes in, just tell her politely, you're not going to accept it. You refuse it. And that's what she ended up doing.
Wow.
So, like, at that point, the nurse did call the doc, who did change it to another.
Now
Yeah.
you got their attention.
Yep. The antibiotic was changed. And 2 days later, she packed up with normal platelet count, normal
Oh,
liver
wow.
function tests, no more headaches, no more dizziness, all better. Off to home she goes, never had
Oh.
any of those symptoms again. So I'm pretty convinced it was the antibiotic.
Oh, come on. Yes, of course. I mean, the validation from the pharmacist, your curiosity just to even
Oh,
inquire and then research, but I must say I'm disappointed that the hospital nurse wasn't listening to the
nope.
patient's symptoms or complaints,
Mm-mm.
and certainly that the physician did not listen, particularly after the blood work came back. Like,
Right.
gee,
And
why did this?
it's also so frustrating that, was me being part of it and counseling her and providing her with information, just angering them even more. And well, we'll show you, we'll just keep the medicine going. You know what I mean? It's like,
Oh, come on now.
egos.
Don't go there. Don't go there yet. No, 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 no. Say it ain't
Uh,
so.
I
No, I
know.
just think I think it's an epidemic of people not listening.
Hmm.
Uh, what I said earlier, it's disappointing that the nurse wouldn't have listened to the patient because she's the one seeing her dizzy and not feeling well, and call the physician and say, "This is something's not right. She came in here, she wasn't dizzy." You know, it's disappointing, really.
Yeah. But
Um,
that's the majority, I think, of what I see anyway. And I'm sure most of us guardian nurses that we see is, if they just listened. When did that go away? If they just listened to the patients. Oh,
uh, yeah, from your lips to God's ears, Alonda.
yeah,
Um,
I know.
I what do you think in terms of the lessons in that story? There's a couple I hear, but for you, what's the lesson that you'd like to share with our listeners?
I think just to give the listeners the permission to say, no, I'm not taking it. I'm not doing it. I mean, you have the right to refuse. And so many of us patients, well, if the doctor says it, it must be true. And that's not always the case.
Right.
You know your body, you know how you react, and it's okay to say no, and it's okay to ask questions and say, please explain to me.
Right. Well,
Oh,
so in a hospital setting, when a nurse is coming in to give the medication, or possibly maybe doing physical therapy or something, the patient is allowed or enabled or encouraged to
right.
make a decision that I don't feel up to it if it's physical therapy, or I don't want that blood draw, right? You can, to your point, say no. You will likely be asked why. Hopefully,
Yeah, and it
right?
will be
Just walk out of the
documented in
room.
your chart.
Right, right. But it's important, to your point, if you're not feeling like you're understood, that they're listening to you, or you don't understand, again, to your point about, I don't understand why you're drawing this blood, or what's this test for? I don't want to have it. Pretty soon people will come running to explain it to you.
Right. But
Yeah, I
in this
hope that.
situation, imagine if she had continued this drug, because I'm not sure how many more doses she had. I was never privy to that information despite asking. But
Okay.
imagine if her liver tests continued to rise. I mean, they could have put her in liver failure, and something that could have been permanent. I
Jeez.
mean, it's scary how far this could have gone.
Isn't the
Oh,
first, the Hippocratic Oath starts with first do no harm?
yeah. Yeah, I think we forgot that one too.
Uh, yeah, that might be the bigger lesson for the doctor, at least. Yeah,
Yeah.
I would not want anyone to have. I mean, certainly when you're in a hospital and they're doing testing, things can happen, right? Things, accidents happen,
Absolutely.
right. But when they're actually ignoring the patient's symptoms and continuing to deliver medication that may be harmful, then you got to feel kind of crappy about the care she's getting.
Yeah,
What?
definitely.
Yeah. So in closing, let me ask you this: like, what would you like the patients who aren't hospitalized to take away from this lesson?
Well, I still think kind of along the same lines. I mean, speak to your primaries and your specialist and be truthful. And if there's a drug that they're suggesting you take or a test, just ask questions. It's okay as a patient to ask questions and get answers before you do something or start something or agree to something, whether it's
Well,
a procedure or a test or whatever the case may be.
but what if you don't know? Like I think of myself when I was being ordered some medication. I didn't ask, and I mean, of course I knew, but all right. So if I was not a nurse and was being ordered medication, what I feel like doctors don't do is explain what the medication will do,
Mm-hmm.
and they certainly don't go over side effects. I think
Oh,
they leave
no,
that to the
no.
pharmacist to do, and you're not going to get that from a CVS or Walgreens. No pharmacists are. I mean, they ask you before you sign off on the drug. Do you have any questions? But patients, I've never seen anybody say, yes, what are the side effects of this medication?
Oh,
Never.
agree. Yeah. Usually my answer is, I'm a nurse. I'm okay.
Right. Well,
So,
you're lucky, but what about the
exactly.
folks that don't have that
Exactly.
education? So then I think it's important for listeners to understand that they can, and it's worthy of a conversation. So and if your physician or nurse practitioner or PA is not willing to engage you in that conversation about your health, then maybe it's time to get another provider.
Oh, absolutely. I just said that actually to a member the other day. She was having trouble getting her doctor to do a medical letter of necessity for a medication. And I had made a couple of calls, and I swear they knew my number and weren't answering that phone. I'm telling you, they did. And I finally said to the member and her husband, I said, I would change physicians. I said, and I have no issue helping you find a new primary. I said, but they're just not responding. And since you really want to be with a practice that's like that, do you
Right.
really want him in charge of your health?
Right.
So,
No, I kudos to you. I think patients don't feel like they can make that change, right? They don't feel empowered. And we at Guardian Nurses feel like, there's plenty of primary care providers out there. Let's get you another one. Let's get you one who's going to be responsive and answer the
right.
phone.
Yep.
That's another lesson. Good for you. 2 lessons, 2 for the price of 1. Alonda, thank you for taking time to speak with me, and I certainly do appreciate all that you do for our firefighter friends in the city of Philadelphia. So thank you very much.
Oh, you're welcome. I love this job. My favorite job ever.
Good. Thank you. All right. Take
Thank
care.
you.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.